here comes the most important aspect of the brachial plexus, that is clinical anatomy. This is very much useful for your first year students in terms of clinical anatomy of brachial plexus, and in the surgery also, in the general surgery also, they might encounter some of these paralysis, etc., etc. And in general medicine also, it may be useful for them to examine the nerves, etc. So the clinical anatomy of nerves affecting upper limb muscles. The objectives are the clinical anatomy of nerves affect upper limb muscles. See the upper limb nerves, that is from full distribution of brachial plexus. The brachial plexus innervate the upper limb muscles, right? So what happens if any injury or any like injury due to trauma or any compressions or any damage occurring to these peripheral nerves can lead to palsy or paralysis of the muscle that innervated by that peripheral nerve. So we'll see here the long thoracic nerve. Injury to long thoracic nerve can cause paralysis of serratus anterior muscle. You know, right? The long thoracic nerve innervate serratus anterior. So if any injury by any factors, by any cause, by any reason, if this long thoracic nerve got injured, it may leads to paralysis of this serratus anterior muscle, which can be clearly visualized as a winging of scapula. The scapula will look like a winging. It's like a wing kind of a thing. It will look like a wing kind of a thing, elevated upwards like that. And the next is suprascapular nerve entrapment. Entrapment is like stuck in between two structures, causing injury. Trapped, entrapment. The suprascapular nerve got entrapped, causing injury to that nerve, suprascapular nerve. See this suprascapular nerve. So the injury to this suprascapular nerve causes muscle wasting of supraspinatus muscle and infraspinatus muscle, and there you can see the muscle wasting of this. And next is the Erb's palsy and Klumpke's palsy. We'll study these two in a comparative way. That's why I have told two at a time. So the Erb's palsy, it's also called as Erb's-Dickson paralysis. It is the injury of the brachial plexus. It is the injury of the brachial plexus at Erb's point, that is C5 and C6 segment, which can lead to waiter's tip. You know, right? Waiters ask like keeping their hand backside, and that's what tip. So waiter's tip hand. The appearance of the hand look like that, so that's why it is called waiter's tip hand. And Klumpke's paralysis. Klumpke's paralysis. It is the injury of the brachial plexus at C8 and T1 segment, causing claw hand. Remember, these can be asked as MCQs. So claw hand. So what is the nerve segment injured can lead to claw hand, that is C8 and T1 segment. Klumpke's paralysis. And axillary nerve damage. Axillary nerve damage can cause due to inferior dislocation of the shoulder joint or damage by fracture of surgical neck of the humerus. And next is the radial nerve injury. You can see radial nerve injury at the axilla and the radial groove. If the injury is at the axilla, it causes wrist drop, wrist R, radial nerve, wrist drop. And the ulnar nerve injury, you can see, if the injury is at the elbow and if it is at the cubital tunnel, those two can cause ulnar claw hand. So if it is solely at the cubital tunnel, it causes cubital tunnel syndrome, and the injury can also cause at wrist hand also. And the median nerve, next comes the median nerve. If the injury is at the axilla, it causes ape hand deformity. If at the wrist, it can also be injured. And if the median nerve injured at the carpal tunnel, causes carpal tunnel syndrome. This is very important in case of the first year students, because there can be a SAQ on this. Carpal tunnel syndrome. What is carpal tunnel syndrome? So as a overview, we have discussed everything. the clinical anatomy of the upper limb nerves, that is brachial plexus nerves injury can cause what type of a what type of paralysis we have discussed. And we will also discuss this point, the spinal segments which control various movements of upper limb. As you can see here, this is the brachial plexus, right? It innervates all upper limb. At the shoulder, the adduction of shoulder is caused by the C5 segment, and the abduction of the shoulder caused by C6 and C7 root segment. At the elbow, flexion of the elbow is caused by C5 and C6 of the spinal root, and the extension of the elbow caused by C6 and C7 spinal root. And at the wrist flexion and fingers, flexion of the fingers is caused by C8 and T1 segment of the brachial plexus. See the lesions of the brachial plexus: Ebb's palsy and Klumpke's palsy or paralysis. The Ebb's palsy is due to the lesion at C5 and C6 spinal root of upper trunk and the C8 T1 of brachial plexus.